So when it comes to exercise nutrition, I always get asked, well, what about supplements? For now, let's just say that the role of supplements is simply convenience. And there is another talk that will be forthcoming that talks about the top supplements that work. But that's honestly a whole topic on its own. And I think it's very important to have just the basic understanding of the basic principles of good nutritional habits. And I always discourage clients or patients to kind of use supplements as a way to solve their issues with exercise. It really begins with a good nutritional program and exercise program that makes sense. Now, beyond health and function is, like we talked about, is exercise performance. So I'll make some recommendations that are more specific to exercise than just quote-unquote wellness. And there's always discussions and controversies in terms of nutrition when it comes to wellness. But once you add exercise into the mix, what is considered best practice for actually feeding the athlete or the recreational athlete, it's undergoing a lot of research right now, and I'm giving you the best available research as we know it today. But I'll be making some recommendations that honestly wouldn't make sense for a person who just sits around and doesn't do any exercise. So for instance, I'll make recommendations about eating certain types of carbohydrates or consuming certain types of nutrients. And if you are a sedentary individual, I would probably not make such recommendations. And we'll get into that very soon. But for now, I am not only looking out for the best possible health outcomes here, but I want to strategize the nutrition to improve your performance in exercise so you can do more reps, so you can do more sets, and possibly break your own personal records in terms of whether you're using strength as a measure or speed, whatever you're into. And the name of the game when it comes to exercise nutrition is how do you control your hormones? And I think the centerpiece here is insulin. So, and we'll talk about a lot of the recommendations that I make because it's based on how I want your body to produce insulin. And insulin is a very important hormone that will enable your body to absorb these nutrients, and we'll go into that in great detail.